Homelessness Town Hall. I'm Al Muratsuchi. I have the privilege of representing Torrance, Redondo Beach, and the South Bay in the California Legislature. I want to welcome everyone for this very important conversation about the homeless crisis and what we all can do about it. I know, first of all, well, let's see, before I go any further, let me first acknowledge some of the elected officials that we have here. We have from the Redondo Beach City Council, Paige Kaludrovich. And representing Supervisor Janice Hahn, we have Ivan Sulich. Yes. All right. We had over 200 people RSVP, but it looks like folks are not here yet. And of course, we have representing the West Basin Municipal Water District, Scott Houston. Where's Scott? There we go. Okay. All right. So we have a great group of homeless service providers that are going to be presenting today. But let me just give you an overview of what you're going to be hearing. Well, first of all, I do want to acknowledge that that time and time again I hear from my constituents that homelessness is one of your top concerns, and in fact I know that is showing up over and over again in statewide polling, that Californians are increasingly concerned about this growing crisis. Here in the South Bay, as your representative, I mean, I've gone on ride-alongs in Torrance and Redondo Beach, down in San Pedro, Harbor Gateway. I've seen the large encampment at Lomita Boulevard and Vermont, and I know that this is a growing issue throughout the South Bay. To that end, the state of California, we have allocated over $24 billion over this past 5 years to try to address this homelessness crisis, with the bulk of that funding going to many of the local service providers that you're going to be hearing from today. But I know that there is increasing frustration with folks not only here in the South Bay but throughout the state, where you're not seeing the results. You're not seeing things getting better. In fact, even after all of this spending, it seems like the crisis is only getting worse. I've heard one person describe the situation as trying to catch water with a net, where we have, we want to have a functioning, effective social safety net, so that, here in the state of California, the world's 5th largest economy, home to many of the world's wealthiest people and communities, at the same time, we are the center of the homelessness crisis in the country. And so, how can we, I think the way this person described it is, we have two big challenges. How do we make a better social safety net so that people often are most vulnerable, whether they're seniors, whether they're those struggling with mental health issues, whether they're folks struggling with substance abuse, veterans. How do we make sure that folks don't end up living on our streets? And so how do we build a better social safety net? At the same time, how do we turn off that stream of the newly homeless? Because what you're going to hear from all of the providers today is that even as many of our local partners that are working hard to address the homeless crisis, that they are getting more and more people off the streets. They're preventing tens of thousands of people from becoming the newly homeless how do we turn off the spigot? How do we turn off that stream of folks that are becoming the newly homeless so that we can all see the progress in addressing this crisis? So, overview of today's hearing. We're going to first be hearing from the South Bay City's Council of Governments. Ronson Chu, the Senior Project Manager of Homeless Services, is going to give an overview of the homeless situation here in the South Bay, as well as identify some trends of what's happening. Following the South Bay COG, we're going to hear from LAHSA, the Los Angeles Homeless Service Authority. They are the countywide coordinator of homeless service providers. And then we're going to hear directly from one of the many direct service providers, the Harbor Interfaith organization. They are a nonprofit that I know I first came across Harbor Interfaith when I visited their bridge homes in San Pedro. Where is Harbor Interfaith? Oh, yeah, there we go. Their bridge homes in San Pedro, and a couple years later, as many of you know, they are the operators of the tiny homes, just less than a block away from here. We're going to hear from Harbor Interfaith, and then we're going to hear directly from two of our cities, the City of Torrance Homeless Services. I had a chance to go on a ride-along with our homeless outreach workers to identify where some of the hotspots are in the encampments here in the City of Torrance. And then last but not least, we're going to hear from the City of Redondo Beach, which has come up with a lot of innovative programs in addressing the homeless crisis. I also had a privilege of going with Lila Omura, the Redondo Beach Homeless Housing Navigator, where I was able to see the passion and the compassion of folks like Lila and all of us, all of the service providers today, as they work hard day in, day out to address this homeless crisis. Following the presentations from the providers who can share their personal experiences in working and addressing this homelessness crisis, we're going to have time for questions and answers and some discussions. I'm hoping that we can use this opportunity to hear from all of you, to have to hear your ideas on what we can do better, what the state of California can do better, what all of the local service providers can do better to address this situation that is facing all of us. So with that, let me call up our first speaker, Ronson Chu with the South Bay City's Council of Governments.
Good afternoon, everyone, and happy Mother's Day weekend for all you moms out there. My name is Ronson Chu. I'm the Senior Project Manager for Homeless Services for the South Bay City's Council of Governments. Let's see. So how many people here don't know what the Council of Governments does? Raise your hands. Okay, good. So there's quite a number of you. So we are a joint powers authority made up of our 16 incorporated cities in the South Bay. We stretch from Inglewood in the north, all the way down to the peninsula of San Pedro in the south, as far east as Carson and the harbor area of LA City, and then of course all the beach cities. Our board is made up of council members that you voted on. So for example, in Torrance, Muratsuchi is our council member that represents Torrance on our board. Cedric Hicks represents the city of Carson on our board, and so on and so forth. We work on regional issues. So these are issues that cities can't address themselves, such as transportation, environmental services, technology, and homeless and senior services, which is what I do. And what I do is I help our 16 cities coordinate services throughout the South Bay. So just getting to the punchline, our South Bay incorporated cities in that box right there, we're doing modestly okay. Our homeless count actually from 2022 to 2023 has declined 1.1%. While compared to LA County and LA City, they've actually increased 9.2, 10.2%. So we're doing modestly better. And these are some of the folks that we've helped. Lila, who you'll meet later on, that's Linda, one of her clients that finally got her keys after a bout of sobriety. She was homeless for a number of years. She's from Redondo Beach. That's Samantha. She was escaping an abusive relationship. This is a family that we helped prevent homelessness. The mother was immobile. This lady is actually a teacher in one of our school districts, and because of the pandemic, they fell in really hard times. So we were able to prevent them from becoming homeless. And that's Kerry right there. He's been paraplegic since birth. If you guys remember, there was a hurricane last year that kind of fizzled out. We got him out of the elements and into a motel room, and he's now housed as well. So those are just some of the people we've helped. And how have we done it? I won't go into this slide in a lot of detail because Redondo Beach will cover it, but we've invested in a lot of services. So using state funds from the Assemblymember, as well as Measure H, we've been able to invest in case management services, housing navigation, homeless court, pellet shelters, single room occupancy beds, and permanent housing. Homeless court is actually a really interesting intervention because a lot of people don't know how that affects homelessness. There's different variations of it, and I'll let the city attorney from Redondo Beach talk more about it. But there's one variation which talks about speeding tickets, parking tickets, things like that. How many of you guys have gone like a speeding ticket or a stop sign ticket or anything like that in your life? And so you know it can get really expensive, but do you guys know what happens? Anyone know what happens if you don't pay that speeding ticket or you don't show up to court? Right, it gets really expensive, but worse, a few years ago you could lose your driver's license and you can't get a job or you can't get an apartment without your driver's license. And even worse than that, if you don't show up to court, you get a bench warrant for failure to appear. So now it shows up on your background check. So you get a jaywalking ticket, you can become homeless. That actually affects a lot of people in Los Angeles. And so that's why the homeless court is very important, because they can expunge those records as long as they do community service or try to improve their livelihoods. So those are all the interventions we invest in to kind of have that modest improvement in homeless services in the South Bay. And these are just photos of examples of that. That's a picture of the Assemblymember Muratsuchi and Redondo Beach. They were awarded $500,000 from the state for the homeless court. And that's a picture of the homeless court right there. It's actually an outdoor court. It's very unique. There's the homeless count. If you guys want to volunteer for that, that's Eric also, who's put on this event. So big thanks to Eric today for doing that. But yeah, you can volunteer for that. It's every January, and we go around and we count how many people are homeless in all of our cities in Los Angeles County. And that's the pallet shelter in Torrance. That's just on the other side of this parking lot. They opened up 40 units. The council member, the mayor, Mayor Chen, Supervisor Han was there for the grand opening event. And that's the pallet shelter in Hawthorne that was opened just last year. Their anniversary celebration is actually on Wednesday. Okay, so just some recent trends and recent studies on homelessness. It's kind of interesting. You know, there's a lot of theories on why the homelessness crisis is what it is and why it's so bad. You know, there's a lot of research being done. Is it substance use? Is that the main driver of homelessness? Well, it doesn't really correlate, because West Virginia has the worst opioid epidemic in the country, but they don't have a homelessness problem. I mean, surely if people are suffering from substance use, they can become homeless, but that's not the primary driver of homelessness, is what they found. Is it poverty? Well, Mississippi has the highest poverty rate in the nation, but they don't have a homelessness problem. And so that's not the main driver as well. But surely, if you are suffering from poverty, you could become homeless, but that's not the main driver. Is it mental health? And actually, in California, we actually have, if suicide is a barometer for mental health, we actually have some of the lowest suicide rates in the country. So it might not be that either, But again, if you are suffering from mental illness, you could become homeless. But also, all the studies are pointing back to the high cost of housing as the main driver of homelessness. And we see that, right? The 20 least affordable cities in the country are in California. Half of America's most expensive cities are apartments in California. Los Angeles is #1 as the least affordable city in the country. So there is a very strong correlation between the cost of housing and homelessness. And so if you see that, you should be asking the question, right? If it's so expensive to live in Torrance or Redondo Beach or anywhere else in California, then why don't people just move? It's so expensive to live here, and if you're going to become homeless, you might as well just move to a different state. And that's one of the most frequent questions we get asked, like why do people stay? And the answer to that question is they do move. It's important for you to understand kind of the flow of people into homelessness. So this is a little bit dated, it's from 2020, but the numbers still still apply. So in the South Bay, we estimate there's about 35,000 rent burdened people in the South Bay. So that means they're paying over 90% of their income on rent. An estimated 15% of those do actually fall into homelessness. So that's about 5,000 people a year. And if you add in the 4,000 people from the 2019 homeless count, you get around roughly 10,000 people that are suffering from homelessness at any given time. Of those, 3,600 people self-resolve. So these are the people that are moving out of the state, moving out of the area to find cheaper rents. These are people that are living with their family members, or they're getting jobs to kind of self-resolve their homelessness. So a lot of people are moving away, and we see this, right? We lost a congressional seat in Congress. We're losing representation in Washington, D.C. because there's a lot of people moving away. We saw that during the pandemic where we ran out of U-Haul trucks. So people are moving because they just can't afford to live here. And then an estimated 1,500 people are housed through the system. So that's kind of how the flow works in homeless services. One thing I do want to touch on is Lila's kind of Lila is one of our best case managers that we have. She's like Superwoman, Batgirl, and Mother Teresa all wrapped into one. And I want to kind of show you like how our best case manager, how the performance that we have. And in any given year, she houses about 24 people. So that's roughly about 2 a month. And that's really the best that we can do, because what's happening is Lila's locked out of our private housing market. So that is the clients that she has that she's trying to get housed, they can't pass the credit check, they don't have the security deposit, and there's other issues that's preventing her from getting those people in the private housing market. So the bar shows every time there's a spike in the bar, that's where she's housing people. And the blue bars are where she's putting people in permanent supportive housing. And the green bars are where she's putting people into the private housing market, like your typical apartment. So as you can see, most of her housing is done in permanent supportive housing. And what is permanent supportive housing? It's a public-private partnership to build subsidized housing. So these are some of the permanent supportive housing that we have in Los Angeles. That's West Haven. Just remember that's over by Western and Imperial. This is like a 3-bedroom apartment. This is a building in Venice. And so they can be really nice. It used to be like the projects when you think of public housing. We stopped building projects since the 1980s. My wife grew up in the projects, but that's not what it is anymore. It's permanent supportive housing. And so they can be really nice. They can be really small, really large. They come in all different shapes and sizes. So the last thing I wanted to get into is just a case study to kind of show you the difficulty sometimes of getting someone indoors. And before I get into it, I want to segregate the homeless population in 2 big groups. There's one group called the high acuity group, and those are the folks that you see. Like, they're the ones that are outside Ralph's, on the street corner, at the bus stops. They're the ones that are suffering from mental illness or substance use, or they have some sort of acuity that's causing them to be outside. And there's this other group called lower acuity. If I were to become homeless, I wouldn't be on the street corner. I would probably be hiding in my car or, feeling embarrassed and being normally out of sight. And these are the people that have just lost their jobs. They maybe are escaping domestic violence. And like I said, they're the unseen homeless. These are the people you don't really see out there. We get folks that are your restaurant workers. We get teachers from Torrance. We have kids from Torrance USD that are homeless. Redondo Beach. Every school district is not immune to this. We have seniors, which is our fastest growing population. And so that's the lower acuity side. And that's the side that we, the case managers here, can help. The higher acuity side is tougher. We do need intervention from the Department of Mental Health to come and help. And they have what's called a home team that can go and visit folks where they're at. And so our case study involves 405 lady. And if you've ever gone off the 405 freeway at Inglewood, from 2017 to 2022, you would have seen her. She was there almost every day, just sitting there. And she was actually Lila's very first client. So that's 405 lady. So she actually went to Maricosta High School in Manhattan Beach. She was just a typical California girl. That's her and her brother. And what happened to her was a family tragedy. Her brother passed away, and her mother passed away shortly after. That sent her down through a spiral of depression and substance use. And so between 2017 and 2022, there were many efforts to outreach to her, but she chased away all those efforts. She chased away Lila, wouldn't talk to her. She was suffering from severe mental illness. There were multiple 5150 holds, 72-hour holds. That's where PD will take them to the nearest hospital, the nearest emergency room, and they'll keep her for 72 hours. But they can't keep them longer than that. So then she's back out on the streets. She suffered through multiple arrests, and this went on for 5 years. But then something miraculous happened in 2022. The courts finally stepped in, and a judge mandated a longer-term hold and mandated medication. And so she got what we call like a miracle shot. It's really this shot that you can get once a month, and it stabilizes a lot of our folks. And so she was getting that. She was finally getting that, and she finally was starting to get stabilized. And once she got stabilized, she finally agreed to shelter. And so we had to act fast, because when they say yes to shelter, when they finally say yes to the help, we have to get them that help as soon as we can, because they could just easily change their mind the next day. So the COG, we stepped in, we paid for a motel stay while we waited for the Redondo Beach pellet shelters to open up a bed. At that point, they were full. And so during this time, she was still hanging out on the 405, and while we were waiting for a bed, the AMH was coming out to the 405 and actually doing a medical procedure on the side of the freeway, giving her that monthly shot. It's really crazy. And then finally, in July 2022, she moves into Redondo Beach Pellet Shelter. She starts receiving more regular wraparound services, and Lila helped her apply for permanent supported housing. And then in September, she got accepted to West Athens, the permanent supported housing site you see there. And she moved in November 2022. We paid for a security deposit, and Section 8 paid for her rent. So it's a long and arduous journey most of the time, and I just wanted to share that. I think that's a great example of kind of the challenges we have with some of the mental illness that we have on our streets. In this case, we had to wait 5 years before the court finally stepped in and sort of gave her that conservatorship mandate. And so that's some of the challenges that we face, and wanted to share that with all of you. Thank you.
Thank you, Ronson. That was an excellent presentation. Not only the overview, thank you very much. Yeah, really humanizing, the homeless that we see day in, day out in the South Bay. I was wondering, can you share at least her first name instead of just the 405 lady? No, that's... Okay, Carrie. All right, Carrie. All right. Thank you. That's I mean, just Maricosta High and all that. I know I've heard these stories over and over again, but thank you for sharing that, and humanizing, putting a human face on the folks that we see on the streets. Next, we have from the Los Angeles Homeless Service Authority, Eric Vargas and Derek Blackshear.
Ronson, that was amazing, my friend. So excellent job up here. It's going to be kind of hard to follow, but hopefully we can. I'm going to put this up for a little bit. And I just want to start off by saying thank you. Thank you guys for inviting us. Eric, also amazing job. I know Ronson's probably giving you a couple of accolades for some of the other projects you've done, but this is amazing, my friend, as well. Hopefully you guys are all pretty familiar with LASA. And we kind of know what that means. So I just want to start by kind of sharing a bit about what our mission is. So our job at LASA is to drive the collaborative strategic vision to create solutions for the crisis of homelessness, grounded in compassion, equity, and inclusion. So what I want to do today is I want to present to you guys, but I also want to have a candid conversation with everybody. I want to share where we've been, where we're at, and where we need to go. Because right now, we're kind of at an unprecedented time. At a time between the county, between the city, and between LASA, where you've all probably seen everybody locking arms. Because the goal for right now, and what LASA's mission is to increase the efficiency of what we're doing for our unhoused neighbors. And so that's our number one goal. And with this locking arms that's going on right now, LASA can really act as a bridge to facilitate healing and to make a more collaborative space, not only between the county and the city, but between everybody here right now. And if we're to move forward, that is something that we must do. We have to remain collaborative. We have to listen to our partners on the ground, our partners with lived experience, and everybody in here today who we consider a partner. You've taken the time out of your day to come here, right? You've taken your time out of your day to listen and to ask questions. We need to show that we're willing to listen to you as well. And that might be where LASA has suffered in the past, where we've kind of been accused of being spread too thin. So what we're doing now is really focusing in on 5 key pillars that our new CEO, Dr. Adams-Kellum, has really helped us focus in on. Namely, address the state of the emergency, improve the movement from interim to permanent housing, be held more accountable, and I think we all can go for that one, and be more transparent with all of you, to be more efficient, and something that's truly dear to me, to be more equitable. And I want to dive more into these, but first I want to make sure we all have an understanding what LASA's role is or how LASA operates. Because sometimes I think we're looked at as a bank, and I know my friends over at Harbor has heard that one before from time to time. So at LASA, we do coordinate or manage nearly $850 million in annual funds. But what I want to make sure is understood that these funds pass through LASA directly to our service providers. Most of these funds are attached to a program that already come with their own requirements. So as much as we wish we could, LASA doesn't just hand out funds here or hand out funds there, although that's something that we're trying to work on. The reason I say this is because we must understand how critical it is for all of our partners to add more housing for us. And when we add housing, we all must say yes to the housing that's being added, but also yes to the housing that's available and take full advantage of all the resources that we have. When our CEO started, it was her initial and her continued goal to really increase LASA's efforts and our impact on reducing unsheltered homelessness. And doing so with compassion, with equity, and with inclusion. Get used to hearing that because I'm going to say it a lot. And as I mentioned before, we've really started to tighten up our focus. So the first thing we needed to do was address the emergency. With our last year homeless count, we saw 55,000 unsheltered people across the county, another 30,000 across the city. And so what we first needed to do at LASA was kind of take a step back and reorganize internally. We needed to come up with new initiatives to address the crisis on the street more efficiently. We need to start moving more intentionally in everything that we did. We need to intentionally move and improve our system to bring more people inside more quickly than ever. And I'm happy to say that LASA was able to respond to the state of emergencies that were declared by the city and by the county. We stood up multi-departmental crisis response teams, and what these teams do is respond and coordinate to the encampment resolutions that you guys may see. We've opened up our new navigation center. That kind of serves as like the bullet train from interim housing to permanent housing. And we've also closely collaborated with the county in their Pathway Home initiative. But I think we can all say that more can be improved upon. So what else we need to improve was our rehousing and our system efficiency. So over the past 4 or 5 years, on average, LASA has housed around 20,000 people per year. However, I think this is a bold statement, but I think you'll all agree that more can be done. And not just more can be done, but more must be done if we're to maximize the potential of our rehousing system. And that's a lot where you all come into play as well. We ask you to hold us accountable to maximize everything that we're doing. Hold us accountable to be transparent with everything that we're doing. And I think under our new LASA leadership, that's really how we're changing the delivery and the services that we do to move people from the streets into housing faster and faster. Because the more effective we are at moving people from shelters to housing, the more beds available we have for the 405 lady that we've seen before. And something I do want to share for success is what used to take us 120 days to lease somebody now only takes 30. But in order to get there, we had to move intentionally. We had to move with purpose. And our purpose is to be accountable and transparent, especially when it comes to data, because data collection and dissemination is at the core of what LASA is and needs to do. And I think we all need that, right? We need to be able to disseminate data out to the people who are working on the ground, the people who are working in the council members, the people who are making data-driven decisions so they can make accurate decisions. In order for us to do that, we're going to continue to ask you to hold us accountable. Make sure we're doing what we're supposed to be doing. And so that's why we like to say, like, the new LASA is here. Because the new LASA is setting measurable and reasonable goals moving forward. And on a bi-weekly basis, we're sharing these goals with the city council members, with the board of supervisors. And I think this is something that you all may have seen, and I know for sure my partners up here have seen that in the past, data has been a bit of an issue at LASA. And what I want to acknowledge is that it may not change overnight, but we are actively taking steps to increase and improve our data management system. That's why we come to these events. And that's why I ask, can I speak candidly with you? I'm hoping that you ask us as many questions as possible. I'm hoping that you put us on the spot. I'm hoping that you share your experiences with us so I can take everything back that can improve our systems. Because our purpose is to actively manage the system, not to just be a funds administrator. Our role is to drive the strategies, to drive the goals, to drive the vision in order for our continuum to succeed. And we were doing this before our new CEO, but under Dr. Cullen's leadership, we have made this our commitment and our priority, meaning we're more committed to you and you are our priority, not just to ourselves. That we are going to ensure that the resources we have available are being utilized efficiently. We're going to ensure that we inform everybody on the best practices and how to move forward. We're going to ensure to lead with our providers, not to just walk side by side. but to walk arm in arm. And we're going to make sure that everybody has the tools necessary to help house our unhoused neighbors. LASA is and must take these bold steps if we're to rebuild the trust that we may have lost with you all in the past. And I know a big spot that we can do this in is being more efficient with who and how we contract out. So something that I'm excited to share is that last year, before the start of the fiscal year of July 1st, we were able to execute 80% of the total contracts, which is something that LASA has not been able to do in the past. And this year, we're on track to surpass that. This year, we're on track to start working with smaller agencies. This year, we're on track to start working with our faith-based organizations as well. And I say that because something very important at LASA is being more equitable. I think we all know that the effects of systemic racism is still a major driver of homelessness in our community. Not just this community, all of our communities. So it's LASA's commitment to weave equity into everything we do, not just because it's the right thing to do, but because it's essential to solving the crisis. So some of the things that we have done is start the ad hoc committee on diversity, equity, and inclusion. And what that does is that helps us dive deeper into not only the how, but the why of why subpopulations start experiencing homelessness. We've established the Latinos Experiencing Homelessness Equity Work Group, and we've partnered with Harvard's Government Performance Lab so in doing so. We've also hired and onboarded our first American Indian Alaskan Native coordinator and our faith-based organization coordinator. And again, what this is going to allow us to do is start meeting people really where they're at, to start working with all types of agencies, not only the largest agencies, not only the agency who's been here the longest or with the most funds, but the new agencies who are arising, the agencies who can really target the populations that are underrepresented and that are underserved. So really quick, I do want to take a look at where we were last year and where we are now. As Ronson has stated, there was a rise in homelessness across the county and across the city, 9%. And though we don't break it out necessarily to only specific areas, I do want to highlight that SPA 8, this area we're at now, saw a 32% rise, totaling at 6,476 people experiencing homelessness last year. And I want to go a little deeper into the demographics about that. Whether that be our transition-age youth who saw an increase, our seniors, our veterans who saw a 43% increase, our families. I also want to highlight something that, as I spoke about equity, for this harbor community, for SPA 8, 14.3% of the total population here is African American or Black. But the African American or Black population makes up 32% of the homeless population. 33% is made up of Hispanics and Latinos. That will not be solved if we do not add equity to everything we do, up here and out there. So I want to take a quick second to just highlight and thank a lot of our providers who we work with. I see Harbor Interface sitting over here, and I really want to just give them a shout out for everything that they do as well. Because without them, there's no LASA. So I know it might be a little hard to see, but everybody you see on the screen is who we work with in some capacity in this area, whether that's interim beds, outreach, time-limited subsidies, prevention. And when I first started at LASA, that list was about the third of the size it is now. But I'm happy to say that under our new leadership, that list will continue to grow. And so before I go back, I want to try something really quick. And I want everybody to understand that it is a lot of work moving forward. So I'm going to ask a lot of work from everybody here. Assemblymember Muratsuchi, I'm going to ask if you can join me real quick. And I want to remind of everybody's mission, of LASA's mission, which is to drive the strategic vision in creating solutions for the crisis of homelessness grounded in equity, compassion, and inclusion. So I wanted to thank you for including us in this conversation. I wanted to thank you guys for being equitable in everything that you do, including us in this conversation. But I want to take the moment to include you guys in the solution. So I'm going to go on a limb right here to show everything. I'm going to ask if a few of my colleagues here can stand. I'm going to ask if Eric will join me as well. And I'm going to ask, I know you guys have all seen this before, but some of our policymakers and our leadership up front, I'm going to ask if you guys can stand as well. You know what? I'm going to ask if everybody in the stands can stand, or everybody in the crowd can stand. Because I want to show you what it takes to solve this crisisness. And I know you've seen this before. And if you'll indulge with me, I'm going to ask if you'll lock arms with me. And I'm going to ask if everybody here will lock arms. Because this is inclusion. What you're doing is equitable. What you're doing is showing compassion. What you're doing is being together. And together is how we're going to find solutions for the crisis. Thank you, everybody.
All right. Thank you very much, Derek. And did you have a presentation? Oh, you do not. Okay. All right. Thank you very much, Derek Blackshear with LASA. Next, we have from the Harbor Interface Services, our Executive Director and CEO, Tahia Hazlett.
Good afternoon. Thank you, Assemblymember, for having us, and thank you for this gathering. I forgot I'm responsible. Okay. Let's see. Okay, there we go. So just a little bit about Harbor Interfaith. I was going to talk about the history and the causes of homelessness as well, and Ronson did an excellent job with putting it all together. But I do just want to add a couple of highlights in that, the history of homelessness dates back. Most people see that it's visible today. They see that the homeless continues to increase. But Harbor Interfaith got its start in 1975, and homeless was on the rise, then. It was just at a smaller scale, mostly families, and so you didn't really see them visible as you do today. But it started in the causes, or, things that still exist today. So it's, really the economy. I think Ronson mentioned the lack of affordable housing, the lack of jobs with livable wages. And so those things still exist today, and so homelessness will continue to increase until we are able to address those causes. I know back in 1980, one of the big causes of homelessness and how we started to see it visible on the street was really with the release of those who were mentally ill from institutions. And so mental illness still exists today. We still haven't figured out how to address mental illness, and that's a contributing factor, along with other things. I hear all the time that people are homeless because of their life choices, and that's not necessarily the case. There's domestic violence that exists. As I mentioned, there's mental illness that exists. Sometimes it's their upbringing, kind of generational, and other times it could be someone who was married and the breadwinner has left. So there's many causes that lead to homelessness. And Harbor Interfaith covers the entire South Bay. And I know Ronson shared a slide as well in terms of the map, and I have one here, so I won't go into detail. But this is our office. We're based in San Pedro. This is our headquarters here, and it just basically says what's the mission of Harbor Interfaith, and really to empower the homeless and working poor to reach their full potential. The map, as I mentioned, is the entire Service Planning Area 8, and so a part of what we do as an agency, we partner with agencies that's throughout the SPA, Service Planning Area, and they address the needs of the homeless in their particular area. So just a little bit, as I mentioned, Harbor Interfaith got its start in 1975, and we were started by volunteers from the faith community. So if you go back to the faith and you know that everyone was working internally within their congregations to help those who were attending, the different congregations with food and with shelter and with housing, Harbor and the Faith was started, and we were started and created in San Pedro, and then in 1983 is really when we started to address the needs of those who were experiencing homelessness. And it was mainly with families, so we had an emergency shelter that we operated housing for homeless families. And again, families you don't really see because there are children involved, and so it's the hidden homeless, but the individuals that you see on the street, it's because they're not tied to kids, and so they're more likely to be on the streets, visible. And then in 1985, we became a 501c3, and then we just continued to add additional services along the way. So this is just kind of a history. We added shelter, we added transitional housing, we became Harbor and the Faith, so it just takes you through who we are. I just want to skip ahead to bring a visual to you in terms of our programs and what we do. So our Family Resource Center is located in San Pedro. And again, as I mentioned, we started as a food pantry. And so still today, volunteers work in the food pantry, and they're able to give the community a 3-day supply of groceries, 3 meals per day. And some of those items we purchase, but we depend a lot on the community. So we take our roots back to the faith community, and they do a lot of drives for us, and the tuna, peanut butter, jelly, all of those things that we distribute, they bring in. We have a clothing closet, we have a hygiene closet, and all of those things, for the most part, come through donations. And so you heard LASA, Los Angeles Homeless Services Authority, talk about being a funder. And a lot of times people think, well, you receive all of this funding, and why is it that we still see people on the street? Why is it that we still see, folks in need? And everything is tied to a particular population, or a specific population. So Harbor and the Faith is put in place to address the needs of those that are funded through the government, but then also those who are funded with private dollars. So we do a lot of private fundraising to address the needs. And so through the Family Resource Center, I'll tell you one of the biggest shifts that we've seen. Most people come to us because of food, and then the case managers meet with them, and they realize food is what brought them to us, but they're not able to pay their rent. They're not able to do other things. If their car breaks down, then they're not able to make it to work. And so that leads to kind of the downward spiral that Ronson talked about. So the food pantry still exists, and that's our hygiene and clothing closet there. And then we also offer child care services. So imagine an agency who started as a food pantry, who added shelter for homeless families, added transitional housing for homeless families. We started to think, though, so what do we do with their kids, right? They're here, they're in our shelter, they're in our transitional housing, but they can't go to work, they can't go to school because we have not addressed the needs of their children. So we added a licensed children's center, and it's named after the former executive director. So we address the needs of kids 6 weeks through school age. So we have a program that operates Monday through Friday, which allows the parents to go to work, go to school, and work on their permanent housing solutions. We pick up from local schools, we bring them back, we help with their homework, and ensure that our goal is for them not to grow up kind of in the upbringing that their parents are going through. So we make a difference here. And that's one of the classrooms. And there's our family shelter that I talked about. So the shelter is also located in San Pedro. It's 90 days for homeless families. And so it's a mom, it's a dad, it's a couple, it can be a grandparent. The common theme is that they must have a child under the age of 18 to qualify. And so our facility is there, and they actually have their own private unit. So each unit has a restroom, it has a kitchen, and then the living quarters for the family. And so the ultimate goal is to find, of course, permanent housing. So they stay with us, they meet with the case manager, and then we work towards permanent housing. This is our transitional housing program. It's also located in the city of San Pedro. It's a 24-unit building. Families can live here for up to 18 months while they focus on higher education. So the goal is at the end of 18 months, they've increased their education, they're able to find a job, and they're able to find permanent housing. So a lot of times you think 18 months, and people come in, I want to be a doctor, and that's wonderful, but let's figure out what it is that you can do within 18 months, and then continue your education after you leave Harbor and the Faith. So this is our transitional housing. So at the onset of the pandemic, we opened a few interim housing shelters, and this first interim housing site was opened in partnership with the county, and Ivan is here. Janice Hahn was really aggressive, and she was our county supervisor, and she had an old building, a health clinic that was no longer being used, and said we can have housing. We can offer shelter for 40 homeless individuals. Now, it was at a time, as I mentioned, the pandemic. I think it was a week or the day before the pandemic hit. But in San Pedro, we started to experience a lot of homelessness that was gathering around the post office. And so the goal was to clean up the area around the post office. So the shelter opened, and it's able to serve 40, as I mentioned, 21 males and 19 females. And the goal, again, is to secure permanent housing. So when they come to us in these interim housing sites, you know, it really is about getting them document ready, making sure that they have an ID, making sure they have a Social Security, making sure they have proof of income, and if they don't, connecting them to proof of income, and preparing them to move on their own. So that's a lot of the work that's being done. The second interim housing site that opened was a Bridge Home, and this was in partnership with our council member. And so this opened in July of 2020. And so one, it was the pandemic, and we were trying to remove those who were homeless on the streets into housing to prevent the spread, of course, of COVID. But then it also, again, addressed the need of serving 100 individuals. So it was 64 male and 36 female. The great thing about the interim housing sites that I'm going through, they're pet friendly. So, you know, believe it or not, and I think Ronson talked about outreach and, you know, the 405 and how many times you have to actually go out. If you can't allow the pets, or if we don't allow the pets to come in, that's, you know, another reason why they don't go into shelter. So it's a pet-friendly environment, both interim housing, bridge housing. They are provided with 3 meals per day, and we partner with Beacon House Association. They're also based in San Pedro, but it's a recovery home for men. They prepare the meals, the 3 meals per day. We have security on site, and again, we're working to move them into permanent housing. The next site is Redondo Beach, which you'll hear from Lila. Congratulations to her. And just so you know, Lila started with Harbor in the Faith. She got her start with Harbor in the Faith. But the Palace Shelter opened, and it serves, currently it serves 20 individuals at that particular site. And that's a picture. And we've been great partners with the city of Redondo Beach, and I see Mike here as well. So as I go through, you know, Harbor Interfaith is partnered, you know, with everyone here, right? And so we're successful because of the partnerships that we have in the cities. And when we talk about homelessness, one of the great things, the cities recognize that homeless exists and they want to do more for their particular city. And so partnering with the cities and partnering with the police departments within the cities and all the elected officials is how, as you know, the South Bay, how we are successful in what it is that we do. So I appreciate everything that the city of Redondo Beach has done. In addition, we have outreach services as well. This is the Torrance Palace Shelter, and I know the Torrance staff is here as well. And so that's just a block away, as our Assembly member mentioned. And so Harbor Interfaith oversees this project. It's also 40 units for homeless individuals. And again, each of the sites have the same common goal in terms of working with them to find permanent housing. And so on-site services at this particular location, we partner with Venice Family Clinic. Harbor Interfaith also partners with Torrance Memorial and Providence Little Company of Mary, Harbor UCLA, and Kaiser. And really the goal is to reduce the number of homeless people that's visiting the emergency departments, right? And so if we can keep them out of the emergency departments, that will free up, you know, availability for those who really have, you know, I mean, I'm not saying they don't truly have issues, but I think it's a safe place for them. And so our partnership really says to the hospital and the hospital staff that there's a place for them to go. There's a, you know, an agency that you can contact. So we do a lot of work with the hospitals that's in the area as well. And then in last year, we partnered with the mayor of Los Angeles, and so we are now the operator of some Inside Safe locations. And so for those who may not know, the Inside Safe is basically cleaning up encampments that you see throughout the area. And so it's taking those who have been in encampments for, you know, 20 years, you know, and saying, we have a place for you to go. Let's bring you in. Let's work on your housing, and it's been successful. And so we operate 4 different locations, and there are motels throughout the South Bay that we clean up encampments, bring them in, and then offer them the same services that we do at our interim housing sites. And then in December of last year, we opened a 76-unit apartment building in the city of Long Beach. And so it's permanent supportive housing, and it's for chronically homeless individuals. And then I'm going to wrap up with talking about the coordinated entry system. It looks really small, or maybe it's my glasses, but The coordinated entry system, Harbor and Faith has been the lead service provider since its inception. And so what it's essentially set up to do, we oversee the coordinated entry system for adults, for families, and for the youth. And so there's 3 different populations with the regional coordinator over each of the populations. And so the goal is really to coordinate the efforts throughout the entire SPA, so the entire service area. So we do a lot of problem solving. There's a lot of matching to available resources. There's a lot of outreach that happens. And then we're able to pay the security deposit and the rent for those who secure permanent housing. We also connect them to some of the interim housing sites. And then a big part of it is the prevention, right? Preventing them from becoming homeless, knowing that there's no additional resources or lower rent out there. So we work a lot to prevent them from becoming homeless. So again, it's really small, but it's basically saying the housing navigation. We have an adult protective services just geared towards the seniors that we work with. And again, for all populations, so adults, families, as well as seniors. So that's what the next slides pretty much talk about, the criteria, how they come to us, the problem solving that we do, and really trying to prevent homelessness. Because what we know is that housing is the biggest challenge. Affordable housing is the biggest challenge that we face. And so if we can keep them in their place, then it just helps overall. What is it that we need to do to help catch up, or what happened, what was the life circumstance? So we have staff that strictly work on that. And then we partner with quite a few agencies. So we partner with PATH, we partner with, I already talked about the cities, 1736 Family Crisis Center, St. Margaret Center. So while Harbor and Faith lead the efforts, it's the partnerships that make the efforts work. It's the partnerships that allows for the success. And then the final thing I think I failed to mention was that we also do a lot of outreach in the beach cities. So we have contracts directly with Hermosa Beach, with Manhattan Beach, and I already mentioned Redondo Beach. But that's Harbor and Faith. Thank you.
Thank you very much, Tahia. Before I introduce our next speaker, I want to, first of all, thank the City of Torrance for letting us use your Toyota Meeting Hall here today. And representing the City of Torrance, we have Councilmember Assam Sheikh. Thanks, sir. And we are also joined from the City of Gardena Councilwoman Paulette Francis. Thank you, Paulette, for joining us. So now next we have representing the City of Torrance, Homeless Services, Zulma Gent, and Valerie Hernandez with the Torrance Office of the City Manager.
Good afternoon. Welcome to the City of Torrance. My name is Valerie Hernandez, and I work as a homeless outreach coordinator for the city. I want to give a huge shout out and thank you to Assemblymember and your staff for giving me this platform to talk and give the community information. Today I will go ahead and talk about a few topics providing homeless outreach here in the city and what it looks like. So this is a background of our 3290 temporary housing village, also known in the back of the courthouse next to the police station. Harbor Interfaith Services, who is our nonprofit homeless service provider, is operating our site. It's professionally trained staff that will develop a housing plan for each client with the goal of finding them more permanent housing. The tiny home village will range from life skills, training, substance abuse disorder treatment, and healthcare services. How to access 3290. So the client has to be literally homeless, and then the client also has to be a resident from Torrance. So for example, they've gone to our middle schools here, high schools here, lived here, owned a home here, or even rented a room here. And the third is the client needs to be willing to accept services. For those who don't qualify for our tiny home village, me and my colleague Norma use our resources and connect clients to a shelter. So regardless if the client is a resident or not, they will always be connected to services some way, somehow. I also wanted to add that each individual entering our program is very unique. No case that comes to us is the same. Some clients entering the program might have lost a job due to COVID, medical crisis, family crisis, or they just got laid off and don't have that family or friend support. These types of clients enter the program, get back on their feet, seek employment, and complete the program within 2 or 3 months. In some cases, we have clients who have been chronically homeless, meaning they have been homeless for a very long time. These clients who are going to need that extra support because recovering from homelessness can be challenging. And this is the reason why we don't have a time limit to our program. Each case is very different. We all work in our different pace, and a client can reside in our tiny home village as long as they're seeking stability. Services provided by the outreach team. So street-based outreach involves experienced teams building relationships with people and connecting them to housing, healthcare, mental health treatment, and other services. This is a process that can vary in length and customized by each individual unique needs. In other words, our work consists of different things, connecting the client with housing. We're very trauma-informed, and we know that no two clients are the same. These are times where we can outreach an individual, and they accept services, and there are other times when we have to constantly outreach an individual, and over time, they'll let us know when they're ready to receive any help. Services provided by the outreach team. How many of you guys have seen our homeless outreach van driving around the city? Well, if you guys haven't, it's hard to miss. It's bright blue, and it says homeless services on the van. The city of Torrance has 2 dedicated vehicles for our homeless individuals. Transportation is very much needed. Transportation to emergency shelter, DMV, their mental health appointments, and much more. And if you guys are wondering what's the furthest I've transported, there was a time where I drove all the way to the city of Burbank because a client of mine got matched to a shelter bed, and that was the only bed available in LA County. Here are some of our partners that we partner up with. We partner up with multiple teams to better support our clients. Venice Family Clinic supports our clients with their medical needs. LASA Outreach Stream connects us with shelter that's outside of our city, and DMH supports with mental health. Our faith-based community helps us with the donations. How to get a hold of the outreach team. For direct contact, you guys can go ahead and contact me or my partner, Norma Olvera. Our phone numbers are on the slide, or you can also email us at outreach@torranceca.gov. 3290 data as of April 2024. Here are some of the data. So 31 clients have been permanently housed via 3290, meaning these clients have entered our tiny home village, completed the program, and got permanently housed. 40 clients are receiving medical services with Venice Family Clinic. 22 clients have been matched to Section 8, and 18 clients have been housed by a street outreach team, meaning me and Norma have successfully housed 18 clients without them going to our tiny home village by providing case management, assisting them with security deposit, first month's rent, or reunification of family. We have addressed 27 areas of concern throughout the whole city, and overall, 315 clients have received outreach services. These are some referrals on submitting referrals. If you guys see somebody experiencing homelessness who's not within the city of Torrance, you guys can go ahead and visit lahop.org and submit a referral through their website. And for Torrance residents, you guys can go ahead and download the My Torrance app, go to the citizens request, submit a request, pin or type the address or location, type the request under homeless, and the referrals will go through me or Norma. Last but not least, the success story that I'll go ahead and be sharing. This client went through our outreach program, intaked at our tiny home village, and got permanently housed in his own apartment. This client was experiencing street homelessness at Victor Park. He has been residing in this park for the past year in his car. When I first met him, he was hesitant about the services and didn't think the tiny home program was going to be a best fit for him. I constantly outreached this client on a weekly basis, trying to get to know him and build that relationship with him. He eventually opened up and decided he wanted some assistance. We started by getting his California ID, his social security card, and his guard card. After assisting him with multiple services, he gained that trust bond between me and him. He told me that he wanted to move forward with disability and was excited for the future. He onboarded our temporary housing village and completed the program by clearing all his warrants, tickets, obtained his guard card and got connected with his mental health provider. Recovering from homelessness can be a challenging and complex process that often requires a combination of resources and support. The difficulty of the process can vary depending on the individual's circumstances, such as length and time spent of homelessness, the availability of resources, the presence of other challenging such as trauma, mental illness, and cost of living. There are several steps that are taken to recover from homelessness, and it all begins with street outreaching. Thank you.
All right, thank you, Valerie. And I just wanted to highlight several things in case you might have missed some of the things that Valerie mentioned. But there was that slide that you put up about who qualifies for the 3290, the tiny homes. And one point that you touched upon was that for someone to live at the tiny homes right next to the Torrance Police Station, you have to be a resident from Torrance. And your bullet point, I'm reading, someone that has lived with a family member in Torrance, had attended a Torrance Unified School District school, or was a previous homeowner or renter in Torrance. And I think that's, I know when I visited the Pallet home in Torrance, I was introduced to one young gentleman who was a South High School graduate who had a mental health episode and became homeless. And, it really struck home to me that, again, in this effort to try to humanize the folks that we're seeing on the streets, that, they're not, those people, whoever those people how you might define that, but, they are us. When I met that gentleman from South High School, I think he was like second or third generation Torrance resident. It just really brought home to me. So thank you, Valerie. And I don't know if you noticed the other thing. I don't know if folks were jotting down but she gave her cell phone number if you have concerns or issues about the homeless in your neighborhood. She did provide her cell number as well as Norma's cell number. So thank you, Valerie, for your presentation. Last but certainly not least, from the city of Redondo Beach, we have Lila Omura, homeless housing navigator, and Mike Webb, Redondo Beach City Attorney.
Well, good afternoon. I'm going to, as the Assembly mentioned, I'm the City Attorney, Mike Webb, and Lila works in my office as a homeless housing navigator. The Daily Breeze has described one of us as an angel. I'll let you decide which one that may be. So in July 1st, 2019, because of the increase in homelessness, the mayor and city council unanimously asked my office to take the lead in addressing homelessness. Now, you can only imagine how desperate they were that they turned to the city attorney to lead the effort in homelessness. But knowing nothing other than prosecution, we took the step of trying to become informed, and that meant speaking to everybody impacted by homelessness. That meant the members of the community whose quality of life were impaired, people who had lived experienced, police department, housing navigators, and we were partnering and continue to partner with Harbor Interfaith to this day. And there were two things I came away with all that research, and one is something I don't know if I've ever repeated to you, but Lila said something that has stuck with me at that first meeting, which is no one wakes up one day and says, I'm going to decide to be homeless today. And so we talked about all the causes, and there are many, and I think, Ronson and Tahi have done a great job in showing that there are many consequences, and so we had to come up with a way to address all the combination of consequences that could affect a particular person. So I came away with 2 goals. Number 1 goal, I had to hire Lila away from Harbor Interfaith, which is the best decision we've made. And the second is we had to break down all the silos of services that people who were unhoused, frequently without a car, without access to a computer, with mental health or drug addiction issues, had to navigate. And we had to break those down. And so I'm in preparing for this, I'm in the very unfamiliar position as the city attorney of bringing you good news and hope. And this gathering here, I can literally say that we work extensively with all of the partners here. And we have, through a lot of hard work and different things we set up, removed those barriers. So this is a chart that, as part of our cooperation, with their permission, I stole from the South Bay COG. And if you can see it, before I turn over to the next slide for Lila, we're dealing with, we want to have a full service from start to finish approach. And most of this is in place, and some of it we're going to add this year. But with Councilmember Kalujarevic, under her leadership with Ronson, we're going to put in place an alternate crisis response for people who are dealing with mental health issues. We already have additional mental health contracts with Clear Recovery Center for both mental health and drug addiction, and we work closely with DMH, who shows up, and so we want to start with that. We have case management and housing navigation, which I'll let Lila talk about. We not only have Lila, we have contracts with Harbor Interfaith and CityNet. We have homeless court, which I'll talk about in a minute, for people who are in the criminal justice system. So and I'll go through each of these, but we have transitional housing and then permanent housing, different types of transitional housing. So it all starts with Lila. It starts with Harbor Interfaith. It starts with CityNet. That's who we want to have responding to the person where someone calls about unhoused individuals. We don't want it to be a patrol officer usually, but in the past it was a patrol officer who wasn't necessarily equipped to deal with it. And so Lila, you take it from there.
I just wanted to share a little bit about our homeless court program that has been such a huge blessing. When I started with Harbor Interfaith in, I can't even remember when, but years ago, I was able to obtain a housing choice voucher for a few of my clients that were living underneath the pier, who did everything they needed to do. They were complying, they had gone to rehab, and they were ready for housing. So when we started looking for housing and started applying, it was denial after denial after denial. So finally I asked a landlord, I said, I can't understand. We've filled out 20 applications. We have spent a lot of money, and this person has changed their life around. What is the barrier? And they said that it was the criminal background, and it could all be, most of it was misdemeanors, trespassing, just simple things like that from years ago. So what I started doing after finding that out, I started trying to convince my client to go into the Torrance courthouse so we can run their record to see if they have any open warrants or any tickets that they had to take care of, because I knew that was a huge barrier. And it was just a huge success because we had the Redondo Beach city prosecutor there who saw me there. I mean, I would bring in several clients a day trying to clean up their record. And, you know, I just had to promise them, because some of these tickets or warrants, I just worked with someone, actually tag teamed with the city of Torrance, an individual with a $500 warrant back from 2001 that was preventing him from passing, you know, a background check for housing. So I'm grateful because the prosecutor told me if you bring them in here, I promise you they will not go to jail. And they were afraid, of course, that they were going to go to jail. So Mike and Joy and Anna and everyone else, they worked the magic to be able to allow me to bring in all my clients on one day a month at the courthouse. So instead of being there, you know, 3 days a week, you know, sometimes 4 or 5 hours at a time waiting for their name to be called, they heard all of my clients' cases in one day, which really was super helpful. And then the pandemic hit.
Okay, wait, so the pandemic hit, and so I called up Judge Honeycutt at the Torrance Courthouse and said, you know, the unhoused aren't showing up. You can't send them a letter. We're losing the progress we're making. And I thought, just crazy enough, would you move it to a parking lot in Redondo Beach? And I thought it would be for the duration of the pandemic. And he agreed. But an interesting thing happened. We chose a date where our unhoused were in a certain area because there were meals provided, both lunch and dinner. And not only did they show up, they showed up more than ever, and they showed up more than even average misdemeanants who have homes do in Torrance, because all our cases go to Torrance. And so you'll see we have a 78% attendance rate of people who are unhoused, and last month we had 100%. And the deputy public defender was exclaiming he'd never had that many, not had all of his clients show up. And a homeless court, it tries to remove as many of those barriers. So it has the LA City attorney brings together Ronson mentioned, they show up even though it's not their cases, because they have agreements with the 10 other prosecuting agencies to dismiss infractions under a certain percentage. We have an extra public defender van that comes up and can expunge eligible crimes. We have additional mental health services. We have additional DMH services. We have additional drug addiction services that follows beyond homeless court day. We have job training, and several of our unhoused individuals have gotten jobs while they're in our transitional pallet shelters. And our most recent piece is the very first step, as Lila drummed into me, is they need to get their ID, as Tahita mentioned. And so you know how it is to deal with DMV. I apologize, Assemblyman, since I know it's a state agency. But my kids had trouble, and they had cars and access to a computer or access to a driver. When on homeless court, which is eligible to anyone who's experiencing homelessness, it doesn't have to be someone who's charged with a crime, they get a flyer that allows them that day, if their housing navigator takes them to DMV, to go to the front of the line. So often they get a driver's license the very first day, and it used to take months to do that. So we try and set them up for success, and it's been helpful. I want to go back a slide. If you could talk about, I know we were going to talk about Carrie. Why don't you talk about Stephen or Max G? Stephen, because so Valerie talked about the longest transport. We have a very good natured relationship with Torrance. So Lila has a longer transport story.
I received a call from Redondo Beach PD that they had an individual that was needing help and that was very vulnerable. So when I got there, I realized that he had some developmental disabilities along with mental health, suffered mental health. He had the development maybe of an 8 or a 10-year-old. It took a while, but I was able to figure out that he was from Connecticut, and he was he got to the U.S. When I believe he was 3, because he was from Vietnam, and his entire family was taken out. They were all killed. So a nice woman adopted him from the age 3 up until 50, just recently. So she took care of him. Unfortunately, she passed away, and that was his only family. He was left to take care of himself. He was in and out of the hospital, and again, it's like a child running around on the streets. So the state of Connecticut put him under a conservatorship, so that they were in charge of him because he could not care for himself. Somehow, he ended up off of his medication and ended up here in Redondo Beach. He doesn't remember how. One of the Connecticut officers told me that they had found his car on a bridge in New York, and it stated, whoever finds this car can have it. It was very difficult because I knew he was vulnerable. I knew I couldn't put him in a regular shelter. I couldn't put him in a motel because, again, he was like a child. It took several months for us to kind of unwind, or for a story to unfold. And because he didn't have identification, it made it even harder. Because I tried to go through the Social Security office. I called and called, trying to get information on his guardian. With a lot of persistence, we were finally able to meet with a supervisor at the Social Security office. I gave him the information that I knew, and he was able to confirm that indeed this individual had been receiving Social Security for his disability since he was a child. I was able to put him into, because this was such a special case, I couldn't put him in our pallet shelter because I didn't have anyone to, he kind of needed 24-hour care at this point. So I work with the faith-based community often. I called my friend at the Beacon Light Mission, which is a Christian shelter in the city of Wilmington, and I explained to her the whole situation, and God bless her, she agreed to take him there and to keep a watch on him the best that she can. 3 days later, he had a meltdown in the dorm, and he ran out of the mission, and he was lost. I mean, as soon as the mission called me, I drove and drove. I was at Harbor Division, you know, the police station. I went into the community centers. I was looking all over for him because I did not want to lose him. Thankfully, on my way home, I just said, it's 6 o'clock, I can't find him. I was coming home, and I got a text message from an officer from Harbor Division that said, I think I have your guy. There was a guy reported in a locked apartment building complex, hugging people, asking people for hugs, and just hugging. And so he went there, and sure enough, it was my guy. So the officer waited until I could get there, and we were able to get him back into the mission, Beacon Light Mission, that night, and worked with his conservator quickly to get him back home. She was unable, I was able to locate the guardian, and she was taking care of her husband that had dementia, so she could not fly here. So with the approval of my supervisors, they allowed me to fly to Connecticut and turn around, and I had to make it back here within 16 hours. And I did it. I did it, and he is, he's home safe. And not to mention, we had to go through TSA and security. That it was a challenge, but I thank God that he is back with his conservator. She met me right when he boarded the plane, so he is safe. And thank God for my bosses that allow this flexibility. Look at that.
Yeah, I'm sure that's the takeaway and I should add, and the reason the time period, we had to comply with the state labor laws, and so you can only work people so many hours, and being on the plane was going to be work. It was going to be work, and the one thing I should add is Lila has a fear of flying. So Lila flew a red-eye out to Connecticut and got on another plane back. However, I approved it, so you may be undecided about which of us is the angel still. We talked a bit about pallet shelters, but we had the first one in the South Bay. We have a good-natured rivalry, but Torrance has a larger one now, so we've been expanded. And the one thing I'll add is we learned you need to have a place for them to get out of survival mode. You know, homeless court wouldn't work as well without the pallet shelters, and pallet shelters wouldn't work as well as without the homeless court. We have also 18 beds, single room occupancy in Wilmington, because like Torrance, only Redondo residents can go there. If we end up with unhoused individuals, we have the beds in the bridge housing. What's interesting, we have a much higher rate than the countywide rate. They're both above 50% for pallet shelters and bridge housing. The exit to permanent housing, which is the goal, is to get people permanently housed. The countywide rate is 17%, and these are over 50%. Do you want to talk about? Permanent housing?
Yeah, our interim housing, our SRO rooms have been also a blessing because the individuals have been able to just stabilize indoors. And so the gentleman in the red, the one in the middle, and the one at the end were all staying at our single rooms in Wilmington. And they are now permanently housed, and this was all in 1 week. 3 of them moved into Beacon Landing's permanent supportive housing.
And we're getting our first, and it was a great partnership. It's the county applied with a nonprofit developer, an operator to the state for a Project Home Key grant, and we're going to get 20 additional, our first permanent supportive housing in Redondo Beach later this year. And then the good news, just to wrap up quickly, is we have the lowest number of homeless in more than a decade in Redondo Beach. This is from the point in time count. They stopped giving smaller cities in I think 2022, which makes sense because they don't necessarily, it correlates well. So we ended up with CityNet, who operates out of Orange County. They do a point in time count, and they do a census for us. And unlike the point in time count, they're allowed to meet people. They're allowed to approach all the homeless individuals. They're sure they can verify that they're truly homeless. And what we found from that is our numbers continue to go down. Our latest census last year was 71. And we get very good workable information, and you can see those concentric circle. We only have one person who's been identified in the census all 3 years. And the definition of functional zero homelessness, which is an ambitious goal, which we're striving towards now, the definition originally was that just that you'd have more people, more outflow to permanent housing than you have inflow. we have already met that. Ronson has added an appropriate but challenging goal of having them a duration of less than 90 days on the street, and we're getting close. Finally, I'd be remiss if I didn't thank all our partners, chief among them, Assemblymember Muratsuchi. You already heard about the $500,000 that he gave us. There are 5 elected officials, including myself, who spent the most time at homeless court and pallet shelters. One of them, 2 of them, three of us are in Redondo, including Councilmember Kalujerovic. One is Supervisor Hahn, and the other is Assemblymember Muratsuchi. He even proposed a bill that got through both houses, but then stalled. And I think we'll have, I hope you renew that when the budget is better, to bring a homeless court throughout the state of California, where they can bring that system together so people can be set up for success. And with that, I was just adding, the 2 things we're adding is we're going to work on preventing homelessness. We have grants out to buy market rate housing and turn them into less than medium housing, preventing more of our residents from going into homelessness. And we have in our budget now a housing navigation supervisor who can do follow-up care that Lila's doing out of spec right now. So we'll have a full circle. So with that, thank you.
Thank you very much, Lila and Mike. And I just want to add to, Mike is a career prosecutor. He's been prosecuting crimes for over 30 years. But when we were pushing this homeless court idea, I mean, Derek, you were talking earlier about equity, it was such an innovative idea that it was trying to use the criminal courts not to incarcerate more people, but to use it as a means of intervening in people's lives. You heard Lila and Mike talking about one of the biggest obstacles to getting people housed is getting them that ID. I mean, something as simple that we all take for granted as an idea, but a long-standing traffic ticket, could be getting in the way of their getting housed, and so I think those are the kinds of innovative ideas that I think Redondo has really been leading by example, we are trying to share a lot of the best practices from communities like Redondo with the rest of the state. And rest assured, Mike, I'm not giving up on that work. You heard several, before we open up for a discussion, I wanted to take this opportunity. You heard a lot of people referring to Lila Omura and all the great work that she's been doing, referred to by the Daily Breeze as the angel of the South Bay for the unhoused. And I think, all of these folks, let's give them all a round of applause. Yeah, all these folks, have dedicated their work to helping the unhoused, helping the most vulnerable that are living on our streets. But every year I have an opportunity as your state representative to honor one unsung hero that doesn't get all the accolades. It's not like a politician that's like up on the city council dais or up in the state legislature or wherever, but day in, day out is doing the work of trying to help people. Lila, I first learned about Lila when she was working with Harbor Interfaith, but because I kept hearing about this, this Torrance woman that's working with Harbor Interfaith, that's helping all these, all the homeless. And then I found out that she has such a great reputation with Harbor Interfaith that Redondo Beach snatched her up and hired her as their homeless navigator. And so when I had an opportunity to, really try to get a ground level appreciation of the homeless situation in Redondo, I went on a ride along with Lila, and she took me to, not only did she take me to, where the encampments, where the, where you don't have large encampments, but where people, where tents exist, and, where there were official or unofficial food pantries operating. Lila's passion and compassion really impressed me. She knew every homeless person in Redondo Beach by name. She knew their life stories. She knew what was holding them back from getting housed. She would see someone on the street and like whip her car around and say, "Hey, how are things going?" And talk about, I'm going to get you're on that waiting list for that voucher. That voucher is going to come through for you next week. And to me, like Lila Omura really captures that is a perfect example of the unsung heroes that we have so many in the community. That day in, day out are trying to make a difference. But I want to take this opportunity to honor Lila Omura as our South Bay Woman of the Year. Yeah.
Thank you so much, Assemblymember Muratsuchi. When I heard about this award, I really didn't believe it until our very last Zoom meeting with Eric. I just could not believe it. So thank you so much. It is such an honor to be given this award. I also wanted to let everyone know why I do this. This isn't really a job for me. This is my passion. And that is through going through my own trials. My father, unfortunately, I grew up with an addict. He was a drug addict. We experienced homelessness ourselves when my father went to prison. And my mom had no idea what was going on. He worked a regular job, so did she, and one day we just became homeless. So as I reach out to other individuals, I could feel the shame, I could feel the embarrassment, I can feel the hopelessness, because especially being of Japanese descent, you don't really see too many Asians or Japanese people that are experiencing homelessness. And my mom's family was very traditional. So she did not share all of the struggles that she had with my father. She kept it to herself. And she worked really hard. She's my hero. She worked 2 full-time jobs. Our car was taken, so she took the public transportation. And she worked years and years to get us out of homelessness, and all of us. It was my mom, myself, and my 2 young brothers. We were sleeping on the floor of my grandmother's house. We did that for years until my mom can get us out of this mess. So I know it's possible, and I'm so grateful for the resources that we have now. Also dealing with the people on our streets, I know they're hurting. And unfortunately, also, when my son was 8, I lost my husband in a tragic accident, which almost left us homeless again because he was a breadwinner. Basically, my check just covered, food, utilities, and we had just purchased our house in Torrance. And again, my mom came to the rescue, and she gave up her place to come move in with me and my son. so I didn't lose the home in Torrance, because I so wanted my son to grow up in Torrance, not in a neighborhood in which he would get in trouble. Especially being a single parent now, I just had to make sure he was safe. So the people that you see on our streets, thankfully we had the support. Not everyone has the support. A grandparent that they could go to, a family member. So they're hurting. And I get this amazing opportunity that God has given me to connect with them, and where they feel no judgment. I just want to hear their stories so I know how to help them. And it's not just giving them housing. That's not the answer. If they're abusing drugs and alcohol, there is a reason. There's pain behind it. So I get this great opportunity to work for the city of Redondo Beach, because I'm not limited on how I can help the individual. So I'm grateful, so grateful for the city of Redondo Beach, and especially my supervisors, Joy Ford and Mike Webb, because they allow me just to go all the way, to go all out. And they don't hold me back. So, and I want to thank Harbor Interfaith. Sherry Weaver, she's retired, but Sherry is the one that gave me a chance. I had no experience whatsoever. And I asked Sherry, please, just give me a chance. Just give me a try. If I don't work, fire me or I'll quit. But just give me a try. And so I'm so grateful for all the relationships that I have built through working at Harbor Interfaith. Super grateful. And to my loving family, my son, who is my heart and my soul. I'm so proud of you, and thank you for being here and for being such a good boy. I know it wasn't easy, but you are everything to me. And to my future daughter-in-law, Vivi, thank you, and to your family for loving Kai and to be part of our family. And Mom, again, you're it. You're my inspiration. You are my hero. And I'm here because of you. And thank you. Thank you so much. And again, thank you, everyone. I'm so happy. Thank you.
Thank you, Lila. We should have had Lila give the closing remarks. I don't know. But we promised everyone that we're going to have an opportunity to hear from you, all of you, your thoughts, your concerns, your ideas on how to make a difference in addressing this crisis of the unhoused. So, want to open up to the audience. Any questions? Yes, ma'am.
Right now, there's, I'm going to hold it. Oh, you're going to hold it, okay. They're becoming homeless at a faster rate than we can house them, as I heard today. And if we want the public to know the truth when they go to the voting booth, we need to be really transparent. And along that same line, when we provide data, we need more of an explanation to put it in context, because just raw data can be misunderstood both ways. Thank you.
All right, thank you. You know, in the interest of giving everyone time to ask their questions or make their comments, unless you have a question directed to maybe one of our panelists, I'm going to keep moving. And so, thank you, Lori, for your comments, and you know, all of us will be available to be able to follow up on your comments. Thank you for sharing. Yes, ma'am. That's fine.
Oh, thank you.
Hi, I'm a nurse, so I have talked to different homeless people, and I have to say that Valerie, I was in contact with regarding one homeless lady, and she came right to the rescue because this woman was robbed several times and didn't have a cell phone, lost her place on the list. So I wanted to thank Valerie. I'm the one who emailed you a long time ago, and then also Lila, I'm a friend of Jeff Ginsburg, and I read how she was helping another homeless guy off the Hermosa Beach Pier. And so those are two great people that are representatives, and I got to see them in real time helping these people. It wasn't just shoving them to the side. These people really do care, so I'm grateful to them for that, and I just wanted to honor you both. Thank you.
Hi, I'm Mark Reagans. I worked 30 years as a psychiatrist with homeless people before retiring recently. And my comment is, you talked a lot about silos, and one of the things that's remaining outside the silos is mental health. You talk about, all your slides have about coordinating or having other agencies come in. There's a difference between integrated services offered on-site by the same agency with the same supervisors and coordinated services. I think if you look at your data for all of these transitional settings, that all of them, we don't get high portions of people into weekly trauma therapy. We don't get high portions of people into psychiatric medications. We don't get high portions into ongoing individual and group 12-step recovery things, because those are left as things we coordinate with rather than integrated. And I think we're missing a big opportunity to use all these transitional settings in order to actually embed those services. There's funding difficulties, but to actually have them be there instead of with another agency.
Hi, Sabrina Gillen. I've been in housing and homeless services for probably about 15 years now. I'm currently over at an organization in the county called Brilliant Corners. And I just wanted to, kind of going back to that first comment / question, if you or someone can educate this group who's here who cares about homelessness and housing on Measure A, as it will hopefully be certified to get on the ballot in November, and maybe even back to that comment that just happened with Prop 1 funding. It doesn't seem like there's a lot of integration between the dollars that are going to behavioral health services and housing, even though 30% of it is going to behavioral health services for housing and homelessness. So two separate things, but really I would love to hear this group talk a little bit about Measure A and the benefits to the community.
That was an excellent question. I can't see exactly where you went. And so being at LATSA, one of the things that we try to do is educate on everything that, so we don't pick sides on anything, and we don't have a huge involvement in everything, but we try to educate everybody as much as we can. So although I can't answer that question directly for you right now to kind of make it make sense for everybody, if you don't mind, I will connect with you afterwards and give you as much information as humanly possible. And then what I'll also do is share all the information I provide to you with Eric, who is our wonderful organizer. And if you guys did sign up here today, I can make sure all the information is sent out to you guys within about a week or two. And that way, I think it'll make more sense when I gather more information for you to kind of make it in an easier, understandable, and an easier, digestible way. Is that an okay answer for your question? Thank you. Thank you.
Okay. Thank you. Yeah.
That's actually a great question. A lot of the resources we talked about today is actually funded by Measure H, which is becoming Measure A. So if you like what you saw today, it's like an infomercial, then it's going to be on the ballot in November. I'm not going to tell you how to vote, but a lot of the stuff that we do is funded by Measure H. And Prop 1 also is helping fund a lot of the mental health resources. And it's going to be funding more of it. In fact, I'm talking to supervisors right now about how we can use some of the Prop 1 money and switch out Measure H money where there's an intersection between homelessness. Brilliant Corners does a lot of the DHS mental health housing, and a lot of that's funded by Measure H, but it can now be funded by Prop 1. And there's a lot of money in Prop 1. And so I'm very excited about that. It barely passed, but there's going to be a lot of money coming into helping those with mental illness in our cities, and that's something to be really excited about.
And I just want to add to the, is this working? Yeah. I just want to add to the Measure 1 comment. I was just talking with Supervisor Janice Hahn yesterday. Ivan is here. But she was talking about one of the exciting plans. Hopefully I'm not getting ahead of any official announcements, but they're working on converting the Metropolitan State Hospital in Norwalk to be able to provide integrated mental health treatment for the unhoused using existing, I think, over 200 room capacity state hospital to reconvert that to provide for mental health for the unhoused. And so I think that's one of many examples of where we're hoping. Mark, I see a perplexed look on your face, and so maybe I can follow up with you if I'm not specifically answering your question. But I was hearing that as a hopeful, a sign of being able to ramp up on the much-needed mental health services for the unhoused. Did I see a hand over here? Yes, ma'am, and in the back.
Yeah, since housing is getting so expensive and new people may become homeless because the rents are going up, isn't there some kind of rent stabilization to offer the landowners just for home parks too? Because a lot of the home parks are going up and up and up every year. I'm just thinking there may be some incentive for landlords to put a halt to this constant increase of rent.
Yeah.
'Cause rents keep going up.
Thank you. I'll take that, and thank you for the very important question. I think we heard from our presenters that the number one reason why the number of the in-house continue to rise, even despite all of the money and the services being provided. And all of the people being provided housing or preventing them from falling into homelessness is the ever-increasing cost of housing, and I know that there was a perfect example of that at the Skyline Mobile Home Park in Torrance, right on PCH, right across the street from the Trader Joe's in South Torrance. There's a mobile home park for seniors. It's a senior housing. It's one of the last remaining pools of affordable housing for seniors in the South Bay. And because of a new landlord there, they've been increasing the rent for the land upon which the mobile homes are located. And so I've had numerous meetings with the Skyline Mobile Home residents about the need for rent stabilization. I did work with mobile home advocates to introduce a bill this year. Unfortunately, it was held in the Assembly Housing Committee because of constitutional issues and its concerns about the impact on rent stabilization for apartments. A bigger picture, not just involving mobile homes, but we're hoping that the city of Torrance will revisit the issue of much-needed rent stabilization, especially for our seniors. I feel that if we can't, provide affordable housing for our seniors, we're all going to become seniors at some point, right? Then we need to make sure that we do everything possible to help and support our seniors. There was a gentleman in the back, and then a ma'am in the middle.
This question is for the last speakers from Redondo Beach. I like to go to the Redondo Pier a lot. However, during the week, there's a lot of homeless and a lot of mental health people. What can you do to clean that up to make it safer for people like me to go to the Redondo Pier during the week when it's slow?
I understand. That's why I am on the pier every day. I'm there every morning, several times a day, actually. And my first clients were all the people that lived underneath the pier. When I first started in Redondo, they said this is a very rough, tough group. Don't even really bother with the people that are living underneath the pier. They've been there for years, and I am proud to say they're all housed. So we're just, we're constantly, it's a beach city, so we're constantly getting new people, but we do have great outreach on the pier. So it is better, and it will get better. We'll keep trying.
And just to add to that, one point that I didn't hear any of the speakers address is that there is a court case that has prevented law enforcement from being able to basically, do what they used to do, which is to, clear out or send the homeless away. Like I've literally heard, for example, a city of Torrance police officer said, go back to the other side of Western Avenue. We know that that's what used to happen, but because of this Martin versus Boise case, which is currently being reviewed by the United States Supreme Court by June 30th. So there is a landmark, upcoming landmark United States Supreme Court decision that's going to directly address the question of whether local law enforcement have the authority to be able to remove someone from a location, either a tent or, if without being able to identify the availability of a shelter bed. That is the current requirement, that they have to identify an available shelter bed in order to move them from any kind of an encampment or a tent. So you might want to stay tuned for that decision. There was a woman in the middle here.
Thank you. To Derek, you said something that I think was very profound, and all of you have kind of alluded to it, and that was that you are committed to transparency. I cannot stress how, for those of us who are citizens, who are taxpayers, how important that is. And the reason I say that is because when we see a media report that shows that people who are on the LA homelessness group who embezzled thousands and hundreds of thousands of dollars, that gives somebody like me who's not on the streets yet, but I'm paying taxes, going, why am I bothering with this if it's not going anywhere? So I think that you are all, if you adopt that idea of transparency and communicating with one another, that would be really terrific, because that helps people like us know. I had the privilege of working with Lila through my church and with Beacon Light Mission for about 10 years, and looking at the homeless and seeing what's happening certainly changed my opinion about a lot of that. But my big question is, the movie Stone Pillow came out in 1985, and that was with Lucille Ball, about being what we used to call a bag lady who was homeless on Santa Monica Boulevard. So it's been around a long time, but my big question is, we've seen reports about other states taking their homeless and moving them here, and because we've got such great weather in California, and particularly here in the beach cities, we tend to have people gravitating here because it's warmer in the winter and it's cooler in the summer. So I'm wondering, now that you all are working together within the county, and I'm hoping that you're working through the state, are there any plans to kind of expand out to other states, and forgive me for being crass, but basically to say, would you keep your homeless to yourself and work as hard as we are on getting them housed?
That's an excellent question. Is this one us too? And I want to start with saying how you mentioned about the data and us being transparent. That is something that we are working as tirelessly as possible to do. And not just share data such as homeless count or information on people experiencing homeless in the area, but also show you where the funds are going, where our money is going, to not just say, oh yeah, we did this, we did that, but to actually show you what we did. And I can also say that our CEO does go from state to state to DC all the time. I think she was in Nevada just recently, and the reason she couldn't be here today is because she's out at another conference working across the states to make sure that we're streamlining everything. So one of the reasons why we've been in the spotlight lately is because of how transformational she's been. So they're looking at us, not only LASA, but California, Los Angeles in general, about what are the best practices. And I'll definitely bring that up as well about, and it may be kind of hard to say to keep your homeless where they're at, right? Like maybe we can't necessarily always say that, because a lot of the question we get is what we're doing, or is California, or is being by the beach actually exasperating the homelessness in the area instead of making it solutions? But the data really does show that people who experience homeless go back to where they're the most comfortable with. So it's a larger question, because a lot of times they truly are from that area, right? It's hard to identify from time to time, but they really are from the area where they gravitate to, because that's where they're most comfortable. But I will tell you that yes, those conversations are ongoing. Our CEO is leading them.
I also wanted to add, there was a recent state audit that found that there is a woeful lack of data in terms of the $24 billion that the state has allocated for the local service providers in the past 5 years. That we need to do a better job of accounting for those dollars and identifying the best practices, what programs, what approaches are the most effective, what are not, and so we just had a state budget committee hearing this past week that I participated in, where that message was sent loud and clear that we need to do a better job in terms of ensuring transparency and accountability. On the point of people moving to California, I suspect Ronson might be a good person, but I'm just going to hold on to the mic in the sake of time. I know that there's a University of California, San Francisco study that is often cited as the most comprehensive study on the homeless in California, and over 70% of those identified as homeless, they are homeless in the community in which they either were living as a renter or in a home, and so it was dispelling this often held notion that states are buying bus tickets or plane tickets to send people to California, that the overwhelming majority are in fact people that are staying where they feel more comfortable, where they know, where they have family or friends, which is their local community. Yeah. Ma'am in the back, and then sir, and then ma'am.
Yes, someone voiced volunteer. I'd like to know, how do I sign up to volunteer?
You want to take that?
I'll say one of the biggest ways you can volunteer, and this goes for everybody in here, is our annual point-in-time homeless count. So that'll take place January 21st to the 23rd of 2025, and you can go out and you can count, or you can even come to a place like this where we had this year and help us run one of our deployment sites. So if anybody is interested in volunteering, please let me know, and I'm happy to give you my card, and we can discuss that further. But there's plenty of opportunities for you, and plenty of opportunities for everybody in here.
And I was just going to add, I'll give you my card. We're always looking for volunteers at Harbor Interfaith, so I'll see you after.
Okay. Yes, the gentleman with the plaid shirt.
Well, okay. So presenters, thank you for your presentations. I guess my comment would be that it seems like you're cherry picking, success stories and photo ops and things like that, which is wonderful for inspiration. But what I'm not seeing is, I hear 24 billion, I hear 855 million. What is LA County getting? So when you say we're getting success, is each success story $1 million, $5 million? What is it? And also, what is the methodology? It's fine to spend money, but when you gather data, how did you arrive at that data? If you said like, well, we counted homeless, but it is factual, not a myth, that when LA City counts, they just kind of drive around and it's not very accurate and it could be plus or minus 20%. So if all I see is that in the net is that we're going to end up taxing more, because we're always going to be a net negative. And environmentally, yes, is this a broken windows thing? Are we attracting by 24 billion we're spending in California? Well, West Virginia, how much are they spending? So these are the questions that we as taxpayers want to know.
Sure.
Thank you.
Okay. Thank you for your question. I'm not sure if you were here in the beginning, where I started off with my comments that even though we have spent all this money, the homeless situation keeps getting worse. And so you're absolutely right that all of us, speaking for myself, I'm frustrated that we've been spending all this money, and yet the number of those living on our streets continue to get higher. That is the fundamental challenge, and that's why I use that metaphor of trying to catch water with a net, where the water keeps flowing in terms of the number of the homeless, and the net is catching some of that water, some of the homeless, from preventing them from becoming homeless, or housing them either in temporary or permanent housing. But still yet, because the numbers keep getting worse because of the fundamental cause of the cost of housing, that is why, and I want to turn it over to Ronson because he had an excellent slide comparing California to other states. And so let me turn it over to Ronson.
Thank you. That's a great question. There are a lot of inefficiencies for sure. I'm just gonna say it because there are so many issues. If you think about one homeless person, right? There could be suffering from mental illness. They have background issues, so they need legal aid. They need a mental health social worker. They could have physical health problems. So it sometimes takes a small village just to help one person. It's very, very expensive to help a homeless person. You just can't get around that. That's just what it is. And so what the county's doing now, LASA and the supervisors, they're focusing on prevention. And Mike touched upon this too. We got to prevent people from becoming homeless. It's hard though because we're seeing a 40% increase in seniors becoming homeless. And if you think about why, if you're a senior on Social Security making $2,000 a month on Social Security income, well, that's all going to your rent now. A one-bedroom apartment in Torrance is north of $2,000. So we can't keep up with the price of housing. And that's what's generating new homeless folks. And so we really need to solve that riddle of the housing shortage. And that's really the key.
I do want to be cognizant of time, so maybe one more question, Assembly Member.
Ma'am, you had your hand up first.
Hi, what Ronson said, and that part of it is if you look at the amount of units that are supposed to have been added, I think that actually
There's only 8,000 units that were being started in the county this past year, which is less than half of what we actually know we need, even just to keep even. And it seems to me that that's really tied with homelessness. And unless we can figure out a way to add more units, we're going to keep going in this never-ending cycle. And I would be interested in what the state and ideas we have to try to fix that.
Yes, thank you. So this goes to, like you said, Ronson's comment about how this ties us back. The homeless, the biggest cause of the rising numbers of the homeless is the cost of housing, and the cost of housing is directly tied to the supply of housing. Simple economics 101, supply and demand. The demand for housing is far outstripping the supply of housing, and so this ties into, you know, another big issue, the issue of housing development in the South Bay, that we can spend a whole separate town hall on. But the state has been pushing and putting all these goals, to put it politely, on cities to build X number of housing units. There's a statewide push to push all cities throughout the state of California to rezone their properties in order to try to encourage all cities, all communities to build more housing. But as many of you may be aware, that has caused great consternation, especially in the South Bay, where, you know, you all have worked so hard to save up to be able to you know, own or rent a home in the South Bay, and so now that you got your piece of the dream, you don't want to, you know, ruin it with more traffic and more housing and more density. And so that has been a big challenge in the South Bay. But I think, you know, bottom line is, and I'll wrap up with this, is that, you know, homelessness, clearly there are multiple factors, but the number one driver of the increasing numbers of the homeless is the cost of housing. That ties into these ongoing debates about, you know, where and how to build more housing in our communities in the South Bay. And that is, again, a topic of a whole nother town hall. I want to thank everyone for coming out today. Let's give another round of applause to all of our panelists. Thank you very much. And today's town hall would not have happened without our hardworking staff. The lead organizer of today's event is Eric Ponce. We also have Melissa Ramoso, our district director, Cody Bridges in the suit, and we also have our great interns that came out to help today. Thank you very much to all of our student interns. This is Olivia from Palos Verdes High School, Gavin Herbers from West High School, Tuay Tai from North High School, Sela from Torrance High School, and Zamaya from San Pedro High School. Thank you very much. I'll stick around for any questions. The panelists, I'm sure, would be happy to talk to you with any further questions. But thank you very much for coming out today. Have a good weekend. Okay. One other announcement.